Dr. Quinn, from your personal experience, you mentioned that you had plastic surgery. So tell us a little bit about what you had done.
Well, I did have plastic surgery. It's not like it sounds. I had a hypertrophic muscle over my eye. So every time I would do an interview, that eye would just go up. I look like The Rock, just one eyebrow up and the other eyebrow down. And a colleague that was a plastic surgeon, he pulled me to the side and he said, "Man, I saw you on the news last night and you look like a detective with one eyebrow up." He said, "Listen, come to my office. Let me do a procedure." And he injected Botox in that muscle. And now when I do the news, hey, those eyes, it stays level. But that was an example of plastic surgery that helped me so that I could better articulate what it is I was saying, not worry about that eye, and get the information out to the patients. And that's just one example of plastic surgery that's not vanity.
Right. Okay. Well, I see that. Now, are there other examples of patients in your practice that you've referred for plastic surgery evaluations for medical reasons, Dr. Quinn?
Most definitely. I mean, I've had countless encounters over the years of patients that have come in. And one example is a number of patients that have had skin lesions that were just not right. They were suspicious. I would refer them to a plastic surgeon. And in some cases, not many, but some, and one is too many, they'd be diagnosed with skin cancer, but diagnosed early. The plastic surgeon would simply remove the lesion with the surrounding tissue in a procedure. And all the cases that I've sent over, they were diagnosed on time, but had they have not been discovered and sent to a plastic surgeon, they could have lost their lives. I've had patients that have had all type of reconstructions, but the take home is plastic surgery is not just for the vein, but it's also for a lot of medical reasons that are very beneficial to a lot of patients. And in some cases, especially in the cancer cases, lives are being saved.
All right, Dr. Quinn, and I just got to ask you this question, but is there any last things you want to leave our audience with related to this interview for those who are thinking about possibly getting plastic surgery?
Most definitely. We just want to reemphasize that plastic surgery is not just a vanity scenario. I mean, I've had children that had cleft palate that were having problems in school because they were feeling less than confident about themselves and had plastic surgery and got it corrected. A patient that had breast cancer, she was had deformity of a breast, had plastic surgery, and now she really felt better about herself and just a happier person, and in just so many ways, especially patients that have had accidents with disfiguring facial deformities, having plastic surgery, feeling better about themselves. Even one lady had deformity of the nose and now she can breathe better, but overwhelmingly plastic surgery is needed and very helpful for a lot of people.
Okay, thanks so much for your time, Dr. Quinn.